Well, howdy YouTube family. It is Bolt CRNA coming to you again with another day's topic. So I asked you guys over on Instagram what you wanted to hear about relating to CRNA school. You asked me a ton of questions. Some of them, a little bit harder to answer than others, but I'm gonna be candid with you and go straight to the core of it and be honest. So let's get into my CRNA school experience now. Quite a few of you just said CRNA school in big letters, and I assume maybe you want like a general overview of where I went to CRNA school. I don't know. So let me just tell you, I went to CRNA school in Jackson, Tennessee, Union University. It's a 3-year doctoral program. What else should I say about it? I started in July 2016 and I finished in July 2019, and that's a general overview. Your next question was steps that I took to get ready for CRNA school. So the steps I took, there's a lot of things you have to do, hoops you have to jump through. So I went to the ICU right out of graduating nursing school. First, I made sure and made all A's in my science courses when I was an undergrad. That's your number one tip. If you're an undergrad and you're trying to go to CRNA school one day, you're taking that chemistry, that physics, that microbiology, that anatomy and physiology 1 and 2, biology 101 or whatever, those courses, pay attention, do well, score well in those classes. Those classes will come back years from now when you're applying to CRNA programs. They're gonna look at those specific courses. So do well in those. What else did I do? I took my GRE, I got 3 letters of recommendation, I did shadowing experience, I went straight to the ICU as a new grad and I got 4 years of ICU experience. I also worked in multiple ICUs in multiple different settings, community hospitals, academic hospitals, medium-sized hospitals, smaller, more rural hospitals. I did all that just so I could be very competitive and show that I could be flexible and work in lots of environments. I also worked in multiple types of ICUs in the sense of like CV ICU, pulmonary ICU, medical surgical ICU, neuro ICU, neurosurgical ICU. So I was able to be cross-trained in all those different ICUs and get different experience with a lot of different machinery and a lot of different techniques. Oh yeah, and I got my CCRN, which is pretty much standard. Everyone has to have your CCRN. Don't waste your time with a bunch of other crazy certifications that are not recommended or requested by the programs. They only recommend the CCRN. What was your job / family / life like during the program? So most programs are not going to let you work at all. I did not work at all throughout the program. And I knew that going into the program, I was pretty much not going to be able to work. I played around with the idea of if the program was kind of easy in the beginning, I'd get a PRN job somewhere locally. But I realized in about 3 weeks into the program, by the time we took our first exam, I realized, oh no, I think I studied 75 hours a week for the first exam for 3 weeks and made like a 78 on it, barely. And I thought, oh no, and that was our one hard class that semester. We didn't even have other hard classes. That was our one main hard class, anatomy and physiology that semester, because they tried to ease us in. And I realized, oh God, no, there's no way I'm gonna be able to try and work at all with this level of studying. So no, I didn't work at all. My family life, I lived alone. My nearest family was 5 hours away from me. So I saw them, a few times a year. And pretty much I studied. I went to school and I studied, and I didn't really have much fun. I mean, I had some fun with some of the classmates, and we would maybe go play golf occasionally, like like a few times a year. Maybe go to a movie theater 5 or 10 times a year, maybe. Some quick, simple things. You'll learn to find ways to do like 2-hour max things once a week. That's a fun thing because that's all you're gonna have time for. Most of your time is going to be spent studying. So a lot of my social life was studying with friends. And that was like the social way that I got to talk to other people or do things, is like go to a coffee shop with friends and study together, and then maybe have discussions throughout studying. So I know it sounds lame, but sadly that's kind of like your 3 years. You mentioned once that you blame CRNA school for being single. Why? So that was a joke. I was kidding about another CRNA was making a joke about romantic life in CRNA school. I said that I fully blame CRNA school for me being single. That's not true. I did date a girl for 6 months in CRNA school, so it's not like I was completely single. But in reality, do I feel like as much time as you're, absorbed up into school, if you're really gonna have that much ability to date and to, mingle like that? Probably not. And if you do, which I did a little, if you do, you're gonna find out most people are not gonna be down for you being busy all the time and not having any free time for them. Most people are not gonna stick around for that. Maybe there was one of my friends who did meet somebody on Bumble and they did, fall in love, and she did, he did hang around, and they're married now. So it's not like it can be an impossible thing in school to meet somebody, but it's definitely not an easy thing. Did you ever deal with mean professors? How did you handle it? I never dealt with any professors who were particularly mean. I wouldn't use the right word as mean. They are merciless, I'll say that. Most of your professors, they expect a pretty intense level of perfection from you. There is a general standard expectation in the anesthesia community, especially in nurse anesthesia, that you will be perfect and that you won't make mistakes and that you will be held to a really high standard. And they don't really take failure. If you fail, they usually throw you to the side. They might give you a little heads up if they see a warning sign that you're heading the wrong direction or something, but it may be one warning, and it's not going to be probably much assistance. It's going to be just a friendly reminder like, watch yourself, and then when you fall, they're going to toss you. So I wouldn't say they're mean, but I wouldn't say that they're going to be very caring, that your life is not really going to matter much to them, and your personal life, I mean. So how did I handle that? I tried to keep my life as organized and situated as I could, and I sacrificed everything else in lieu of CRNA school. And so I just made everything about CRNA school so that I could get by and I didn't have to deal with that phone conversation or that issue where I'm being dismissed from the program or something's wrong. Try and fly under the radar, which is a terrible thing to say. I hate saying that, but in a sense, you don't want to be on the professor's radar very much. What were your studying hacks in grad school? So I tried a lot of different ways. The way that most people know that I study by was auditory, because it's mostly the way I learned is through auditory. I would go to lecture, and I actually am one of those people who actually gets a lot out of lecture by sitting in class and listening to the teacher speaking and understanding what they're saying, and as they're talking about the topic, I can usually process it as long as it's not too high level. If it gets like too intense, which it did all the time in CRNA school, I get lost and I can't keep up. But like when I was in nursing school or undergrad, 85% of my learning and studying was done in lecture. Like I would just sit in lecture, I would think as they're talking, I would absorb what they're saying, and I could probably took the test then and made an 80 on it. The way that I would make a 90 or 100 is by going home and looking over a couple little notes I took and refreshing my memory of what they said in class, but I could kind of just remember. But yeah, CRNA school, you can't do that. CRNA school, they just speak too fast, the information's too difficult, they're speaking too quickly, they're covering topics for hours and hours and hours nonstop of just very complex information. I specifically remember many times sitting in class thinking, how does your brain actually hurt? Like, how does my brain actually feel like someone is injuring it right now by you speaking? But it was just fatigued out. Like my capacity for absorbing what they were saying and trying to keep up was just totally taxed all the time. And so the only way to keep up with that is to record them speaking, so I could go home and I could re-listen to them speaking again a second and third or fourth time. And I even found ways for me to listen to what they were saying, make notes up about what they're saying, almost like word by word, writing out what they're saying, like a transcript, and then I would speak that transcript back into this actual podcast mic here that I bought for school, and I would record it in GarageBand on your MacBook Pro, and then I would download it to my iPhone, and I would listen to it while I slept, worked out at the gym, did the dishes, drove to a clinical site or whatever. I would re-listen to myself speaking the lecture from the notes. So that really helped me a lot. It's a lot of work. I'm telling you, it's a lot of work, and that wasn't even the only way that I studied. I used multiple other methods too, but that was a core one that I used. It's very, very time consuming, but if you're an auditory learner, it's worth it. How did I prepare to pay for CRNA school? So that was part of the reason that I did 2 years of travel nursing before I applied to CRNA school. I knew I wanted to travel and see the world, which was an aspect of it. I knew I wanted to make a bunch of money. That's an aspect of it. But the other thing is I wanted to save my my earnings into a savings account so that I could help supplement some of the costs of CRNA school. The joke's on me that CRNA school, no matter, I think I had $65,000 in a savings account when I started the program, and I needed like well over 3 times that to pay for school. So, so yeah, I mean, it's just, unless you just work for years and years and years, you're not going to be able to pay outright for CRNA school. But you can always supplement it, and I think it's important to at least have a little bit in savings before you start the program, because things will come up. You don't want to be struggling from loan disbursement check to loan disbursement check hoping to get by. How to not take things personal in clinical rotations. So this is a popular topic and a big issue that people in my own program, they had all the time, and I notice other people have, is they will take things very personal from what's said to you. You're treated pretty awful a lot of times in clinical, in training for anesthesia, in a unique way that I had never experienced before. And it's especially bad because, at least in nursing school, you're coming in as a nurseling. If someone's kind of rude or disrespectful to you, you're kind of thinking, well, I don't really know anything right now. I barely know how to help you even start a single IV. I don't understand any of these things. I am kind of a burden to you. I am probably in your way. So yeah, you're rude, but I am kind of useless. It's really rough when you go become an ICU nurse. You become the top of your field in ICU, and you feel very proficient, and you accomplish all these things, and then you start training, and then you gain even more clinical knowledge and all this pathophysiology and all this extra medical knowledge that you didn't have before. Then you start rotations to start doing clinical practice, and you're treated like gum on somebody's shoe, like you're worthless and you can't do anything, and people will talk to you like that and treat you like that. And it's just a really odd thing to get your mind wrapped around, that anyone would talk to you like that, especially people who 2 years ago when you were working in the ICU would have, like, certain physicians or whoever may have been working with you would have been very nice to you and very respectful and treated you like a collegial member of the team and all kinds of stuff. And then now you're in anesthesia training, suddenly you're filth on their foot, and they're talking to you like a dog, and you can't really figure it out. So yeah, I would say it's tough, and I don't say that there's not like an easy way to figure this out of how to deal with this. The way I dealt with it, and this is the way I deal with things in life in general, is if someone's talking to me and they're saying something that I don't agree with, I just don't receive it. It's especially if it's not someone who is a personal close friend of mine or a mentor that I've accepted into my life, who I allow to speak into my life. I don't receive what they're saying. There's a lot of words that are spoken out there, and there's a lot of trash that's said out there. You can't let that into your mind and your psyche because it's trash. You let it go like Teflon on your skin. And that's mostly what you're gonna have to do in clinical. You're gonna have to decide, like, where is this coming from? Where is this person coming from? Is this person coming from a place? If it was a preceptor who I generally had like a connection with and I knew had my best interest at heart and was actually trying to teach me something sincerely and was doing it appropriately and trying to be, you know, a respectful, decent teacher, then of course take it. I mean, you need to take constructive criticism and feedback. It's gonna be necessary for your training. But there's a lot of people out there who are not necessarily doing it the right way. They're doing it out of an aggressive, anger, broken place within themselves. That's a problem within them. And you can't let that come onto you, because that's not your fault, that's not your problem. That's something for them to work out and maybe some therapy. So yeah, think about your skin like Teflon. When they're being like that in clinical, let it go off of you. Forget they even said it. What's an aspect of training you wished you got more exposure with? So the one thing that I felt like I pursued a lot in undergrad, and I even have tons of videos in training about peripheral nerve blocks and things like that, but I feel like there are just so many nuances to blocks and different ways to do blocks and different people's anatomy and stuff, that since I've been in practice, I have learned there are even more things I want to know about peripheral nerve blocks, advanced peripheral nerve blocks. And you find in certain settings, there'll be a certain person in the group who's really good at blocks, and they'll have that person doing a lot of the blocks for your workflow and stuff. and you just find it's hard as the new person in the group to like worm your way in there. So you don't do them as much as you thought you would do them or you wanted to do them. And then the random time you do it, you're like, okay, well, I'm not doing them all the time now. I do it like once in a while, and you're not as fluid as the other guy is. So anyway, it's one of those things that I think everybody wishes they did more in training, but unless you just do it a lot when you're out into practice, it's something that you kind of start slipping a little on. So then you have block classes you can take, which I am going to take a refresher block course imminently here. But yeah, that would be one thing I would say, really focus. That's something that is very important in practice, is peripheral nerve blocks, especially in the future of anesthesia. And so really focus on that when you're in school. What's your favorite type of case to provide anesthesia for? I don't really have an exact favorite type of case. I like working in plastics cases. I like general OR cases like hernias and lap choles and lap appies. I enjoy eye days. I enjoy podiatry days. Yeah, I enjoy L&D cases and C-sections on occasion. I like a mixture of a lot of different things. There are certain types of cases I don't enjoy, but yeah, in general, I like a wide variety of anesthesia. Do you have silly classes like theory during your DNP like you did for the BSN, or is it all anesthesia based? So I'll say for my program's DNP, it was very anesthesia based, very heavy in anesthesia. You of course had, each semester we probably had 1 to 2 research that / theory / not clinical anesthesia type courses like epidemiology, healthcare ethics, healthcare policy and legislation, like where you talk about Obamacare and you talk about how these laws affect medicine and how it affects nursing and how it affects billing processes and how it affects care to different patients and underserved populations. There's a lot of topics in the doctoral CRNA program that's a more macro view over healthcare and nursing and leadership and administration. That's not just specific, how do you administer drugs to a patient and how do you manage perioperative care of a patient. And the reason that is because there is a much larger scope of view of what we do in anesthesia and what we do as CRNAs than just hands-on technical skills of administering anesthesia. That's the purpose of the DNP. So yes, you will have courses that teach you about how to, do leadership tasks. You're going to have people who are executive leaders of, hospitals and stuff, who are going to be your professors that are going to teach you ways that they assess statistical data that lets them know how the organization's running and things like that. And the whole idea is it's grooming you to be able to do those things when you get out. And I don't do them actively right now myself, but I understand that process, and I may transition into a role like that in some capacity in the near future. Please talk about IVs, central lines, A lines in CRNA school. What do you want me to talk about? You're going to put in a lot of IVs and A lines. You're probably going to put in 15, 20 central lines. You're not going to do a ton of central lines. They're really not very popular for anesthesia or for surgery anymore. So yeah, and even I feel like in the ICUs, when I was transitioning from the ICU into CRNA school, even back then, people were already different facilities were trying to say like pull the central lines, don't put a central line in, put multiple peripheral IVs. It's kind of the trend to not do as much of the invasive central lines as you can, obviously for reasons that technically you can get pretty much as good access with a good 18 gauges than you would with a central line, but also infection risks, also introducing an object into a patient's body. If you don't have to do that, there's complications and risks with that procedure. So yeah, you will do central lines. I probably did 15 or 20 of them in school. I do a ton in practice. I've done maybe 3 in the last 2 years. It's not common to do them. If you're doing them, it's because it's like a big sick case if something's wrong. Yeah, I mean, you're gonna do them and you're gonna learn them, and they're scary in the beginning, but you're gonna become comfortable in doing them as you continue to do it and get practice. How do you handle going to class all day and studying all night and staying healthy? I mean, it's time management. That's the name of the game for CRNA school, time management. You're going to learn how to be in class all day, then you're gonna go home and maybe have an hour where you do nothing to detox your brain for a second, and then you're gonna go to the gym, go for a run, drink a bunch of water, do your laundry, listen to lecture again, cook dinner. You're not gonna really have much time for free time or anything like that, fun stuff, but yeah, I mean, you just time manage. Learning to intubate with big exclamation marks. That's going to be your first skill you learn in clinical. I mean, you're going to learn in sim lab during your first year before you start clinical rotations. You're going to understand how to intubate technically, like the skills, and you're going to be doing it on mannequins multiple times and do checkoffs about it and stuff. But your actual learning how to intubate true patients will be your first week in clinical. And it's scary. And it's, you know, I remember very much like being very frightened but when they handed me that Mac blade and said like, okay, I'm going to push the sucks now, go ahead. And I'll never forget the Egyptian physician anesthesiologist I was with my very first day of clinical. She's very sweet and she's a very good teacher. And she pulled me aside and she said, you know, we're going to get this. She'd been doing it 25 years. And she was like, you're going to be fine. I'm just going to push the drugs real quick. Go ahead. And she just pushed the drugs and just suddenly like go and intubate them. I thought, my God, this patient stopped breathing. If I don't intubate them, they're going to die. You know, the pressure, the intensity. And anyway, you know, of course I intubated them, and the rest is history. You will learn how to do that, and it will be scary, but you will understand how to do it. Did you do study groups in CRNA school, or did you ride solo? So you'll find most people in CRNA school prefer to study solo because it's easier to focus. You're covering a vast amount of material, and honestly, when you're in a study group, you get distracted a lot. There's lots of other talking about things that don't have anything to do with the subject. So most people in CRNA school don't want to study in study groups because you just don't have the luxury of getting distracted and getting off course. And especially if it means you're going to fail the class or flunk out of the program. People take that really, really seriously. And I actually had some friends in the first year who, I prefer studying in a group because I like to talk and I like to hear auditory stuff. So if I hear you talking about it and me talking about it, I'm going to memorize it better. But other people in the class, most everybody didn't like it. And I had a couple friends who I tried to get into a study group with me, but over the first year we just realized it wasn't happening. And we got into quite a few, you know, rough discussions where they were not happy with me because they were not remembering the material that well auditory wise, and they needed to study by themselves, and they pretty much let it be clear like it's gonna mess me up if we keep studying together. So I learned how to study by myself. Imposter syndrome in CRNA school. Yeah, I mean, I feel like everybody that I speak to, whether it be people in residency, physicians in residency, or it's CRNA students or NP students or PA students or any of that, people who are practicing as providers, taking care of patients, there's just a lot of pressure, there's a lot of responsibility put on that. And the reality is there's no way to know everything about the topic, there's no way to know everything about all the topics that you're going to somehow, you know, come across in your clinical time. And you realize that in training pretty early on, that no matter how much you study or how much you do, there's always something you don't remember or don't know or you come across you've not seen before. And it does, it kind of gives you a little bit of that imposter syndrome where you feel like maybe you're not smart enough, or maybe you're not good enough, or maybe you don't know enough, or something like that. But then you realize everybody thinks that. And all the older people, the older CRNAs you talk to, or the older physicians you talk to who are mentoring you, who tell you like they felt the same way and still do at 50 years old. And so there will always be times where in your mind you're going to think I'm not good enough for this or whatever. But you have to realize that's an incorrect way to think. So you got to let that go. Is it possible to go from CRNA to physician anesthesiologist? So this person, I think maybe is in high school and is not sure how the paths work. So these are two different paths to both go to become an anesthesia provider, and there's no crossover between them. I mean, our practice is like the Venn diagram of what we do is very much overlapped, but as far as like the degrees or the educational path, there's not any crossover. Even way back in undergrad, if you're even in nursing school, you're on the opposite path from med school. Nursing school is a total different way of learning, of studying, of focus. You know, you're going through a lot of really difficult, rigorous stuff in nursing school for your undergrad. That's not necessary if you're trying to go to med school. And then if you graduate nursing school and then you go into becoming a nurse and working and functioning as a nurse and going through all the tough things that you deal with as a nurse and understanding all that clinical aspects, none of that is required for med school. So you're doing all of this work over here for no reason. Like, I'm not saying it'll hurt you, but it's unnecessary. It's a total different path you're on. And then you go to CRNA school and you go through all of that 3 years and spend all that money for all that training and education. You grow out and you get licensed as a CRNA and you pass boards. You're a fully licensed independent anesthesia provider. So why would you go try and jump track to a whole different path that you're gonna have to start at the bottom down here and 8 years later finish that training to come out and do essentially what you're already doing? It doesn't really make sense. So if you are really interested in being a physician and then practicing anesthesia, just from the beginning, way back before you go to nursing school, just go to med school, or I'm not med school, go do like an undergrad in biology or something simple, something, not simple, I mean those are hard classes, but don't do nursing school. Don't do like the most intense, rigorous undergrad you can do. Do something that you can have fun on the weekends and do other things and study for the MCAT and then go to med school and then do residency, but don't do a whole different path. So no, there is no crossover between us, besides professionally we work together. What I wish I knew going into my first week of clinical, I mean, we're pretty well prepared. Our program spent months beforehand really just hammering drugs and information. I wouldn't say there was anything that I didn't know that I should have known. We spent a whole year in didactics before clinical rotation. Maybe, I don't know. That's a really good question. First few days in the OR as an SRNA. That kind of goes into the last question, like preparing for clinical and stuff. My first few days, it was just scary. I mean, you're scared because it's an environment you're not used to. You're dealing with situations you're not used to. It's pretty intense. You have a lot of expectations and responsibility on you now all of a sudden to perform in a way that you've not been performing before. It's the first time you've stepped into a clinical environment like a hospital and you have practiced not as a nurse but as a provider. And not just as a provider but an anesthesia provider, which is pretty much functioning in critical care, high-level situations where people could live or die based off actions you're doing. So there's a lot of stress. And I'll say that you just really have to be very vigilant and communicate and focus on talking with whoever's precepting you, and don't do anything you don't feel safe doing if there's not someone there who's guiding you and making sure that you're in a good spot. Someone asked interpersonal things with classes and preceptors. I mean, you're gonna have a lot of personalities in school, you're gonna have a lot of personalities in clinicals. Learn now how to deal with personalities. Luckily, all of you guys were ICU nurses. You've dealt with personalities in the ICU. You understand that there are certain people and behaviors in those environments, and you're going to deal with those again in CRNA school. And in fact, I would say they're actually going to be even worse in CRNA school. Yeah, it's like all the personalities you dealt with before turned up to 11. And last question, you asked me, do I recommend getting a tutor in CRNA school? Not really. I did have mentors, upperclassmen, who helped me study some and kind of taught me a few techniques and things that would help me out, but I didn't have a specific tutor. If you're really struggling in a class, definitely get a tutor. Don't struggle in a course. Don't let yourself start failing or getting into a bad situation because you're too proud to say I need a tutor, or you didn't want to like go spend the time to go establish a relationship with a tutor. Definitely do that if you're struggling in a class at all. Well, all right guys, that was my experience in CRNA school. I hope that you enjoyed this video. I want to hear down below what your experience was like in CRNA school, and if you agree with what I experienced. I also want you to smash that like button and hit that subscribe button because that helps out the YouTube algorithm. If you want to get into CRNA school yourself, go ahead over to the memberships on this channel. I offer study guides over there, mock interviews, anything that you need to get into CRNA school, I've got you over there. So join up on the memberships. Otherwise, that's Bolt out.